Cancer. It's a word we all know. And let's be honest, it's a word that carries a lot of weight. But what is it really? Well, today we're going to strip away the complexity and give you a straight-up foundational guide to what it is, how it's found, and how it's treated. Let's get right into it.
Here's how we're going to tackle this. We've got 5 sections. We'll kick things off with the absolute basics, then we'll get into the warning signs you should know. After that, we'll walk through how it's diagnosed, check out the treatment playbook, and wrap up with the all-important idea of care that goes beyond the cure.
All right, let's start at square one. Section 1, the foundation. What exactly is cancer?
Okay, so at its very core, cancer is all about cells that have basically gone rogue. Think about it. Our bodies are made of trillions of cells that know the rules. They grow and divide in a super orderly way. But cancerous cells, they just ignore those rules completely. They grow and divide without any breaks, and all that unchecked growth can form clumps we call tumors, which can then start to invade healthy tissue.
And believe me, this isn't some rare thing. Just look at the global numbers to get a sense of the scale here. Lung cancer tops the chart with about 2.5 million new cases every year. Right behind it is breast cancer at 2.3 million and colorectal cancer at 1.9 million. These numbers really drive home just how important it is for all of us to understand this disease. So now we kind of get what it is. But how would you even know? That brings us to our second section, the signals. Let's talk about the warning signs we all should be aware of. So just for a second, what comes to your mind? What are the first things you think of when you hear about the symptoms of cancer? Let's take a look at some of the most common ones. First up, the one that's probably the most well-known, unusual lumps or swelling. This could be a sign of a tumor, and it's something that should always be checked out by a doctor. Another really big signal? Losing weight when you're not even trying to. If you see the pounds just dropping off without any change to your diet or exercise, well, that could be a sign that your body is fighting something behind the scenes. And then there's pain. We're not talking about a random ache here and there. We're talking about persistent, unexplained pain, the kind that just hangs around. It's a crucial signal that something needs to be investigated. But hey, the list definitely doesn't stop there. Just look at how varied these other symptoms are. Everything from being tired all the time, to skin changes, to a cough that just won't go away. The big takeaway here is not to self-diagnose. Think of these as clues, your body's way of saying, hey, it might be time to have a chat with a doctor. And what about the things that can increase the risk? Well, it's a mix. You've got lifestyle factors, like using tobacco, drinking alcohol, or diet. But then you have things that are pretty much out of our control, right? Like our genetics, or simply getting older. Understanding both sides of this gives us a much clearer picture.
So, if someone has symptoms and goes to a doctor, what's next? This brings us right to section 3, the investigation. This is all about the journey to getting a real formal diagnosis.
The process here is actually very logical, very step-by-step. It all starts with a deep dive into your medical history and a physical exam. If the doctor has any concerns, the next step is usually to get a look inside with things like blood tests or imaging scans like X-rays or MRIs. But the final word, the thing that gives a definitive yes or no, almost always comes from a biopsy, where they take a tiny piece of tissue to look at under a microscope. So, once a diagnosis is confirmed, everything shifts. It's time to create a battle plan. And that brings us to section 4, the treatment playbook. This is where strategy is absolutely everything. You know, there's a common idea that all cancer treatment is about getting a cure. But the goals can actually be different. You have curative treatment, which, yes, aims to get rid of the cancer completely. But you also have palliative treatment, and this is focused on managing symptoms and making sure a person's quality of life is as good as it can be, especially when a cure isn't on the table. Both of these are incredibly important. And the strategy here gets really smart. It's definitely not one size fits all. You've got adjuvant therapy, which is given after the main treatment, kind of like a cleanup crew to catch any stray cells. Then there's neoadjuvant therapy, which happens before surgery to shrink a tumor down. And you even have maintenance therapy, which is all about keeping the cancer in check over the long term. And the tools in the toolbox for all this, they are so varied and are getting better all the time. The main pillars are things like surgery to physically remove tumors, radiation and chemotherapy to kill the cancer cells, and then you have these amazing newer approaches like immunotherapy, which actually uses your body's own immune system to join the fight. But fighting cancer, it's about so much more than just the medical stuff. And that brings us to our final and honestly, such a vital section, the support system. This is about the care that happens beyond the cure. See, modern cancer care is really a 360-degree approach. It's about treating the whole person, not just the disease. So yeah, it's managing pain, but it's also about making sure you have nutritional support. It's about preventing infections, but it's also about offering that psychosocial and spiritual support for what is an enormous emotional journey. So if there's just one thing you take away from all of this today, let it be this. Yes, cancer is complex. It's a tough opponent. But the way we meet it, the way we fight it, is structured, it's systematic, and it is incredibly comprehensive. And that leaves us with a pretty exciting question to think about. With all these amazing new therapies and personalized medicine just exploding onto the scene, what is this playbook going to look like in the next 10 years? It's a huge challenge for sure, but there is so much hope on the horizon. Thanks for joining me.